The premiere episode of NewsMakers will explore how school openings have gone this year. Some local superintendents and a few parents will join us for an in-depth discussion of how schools, students, and parents have weathered the past few weeks. The premiere episode of NewsMakers, presented by WNIN and the Evansville Courier and Press, is coming up next. WNIN and the Evansville Courier and Press have joined forces to present a weekly series, NewsMakers. Each week, we'll examine local issues with the newsmakers themselves. The topic this week is how local school openings have gone this year. Before we delve into that issue, I'm joined by Tim Black, President and CEO of WNIN, and Cindy Andrews, Executive Editor of the Evansville Courier and Press and the Henderson Gleaner. Cindy is also the Regional Editor for Gannett, Southern Indiana. They're here to talk about why this partnership is important to them. So thank you for being here, and tell us, why is this partnership important?
Well, first of all, Tom, I want to say thanks to both you and Cindy as representatives of the Courier and Press and the Gleaner for working with WNIN on this. It's something that, from the standpoint of a PBS station, of course, obviously WNIN is known for its NPR affiliation as well. We really see our role in the community as helping our viewers, our listeners, hopefully your readers, to understand a little bit better about what's going on in the area. And I just personally feel and professionally feel that a program like this sort of falls into that public affairs arena that takes a little bit of a longer, slower look at issues is just extremely important for any community.
And we certainly love any opportunity to partner with public media. You know, we consider ourselves to be, providing a public service as well, certainly. And this partnership, which is a revisiting of a partnership from a decade or so ago, I think, that was very successful, gives us an opportunity to reach a little different audience. An audience that's interested in getting its news through video versus the printed word or a digital story, and on both sides of the river, Vanderburgh, Warwick counties, elsewhere in southwestern Indiana, as well as north Kentucky, western Kentucky over the river. So, and it also, as you said, Tim, gives us an opportunity to delve deeper into the news, and some of the topics that we're going to be covering in coming months are topics that we're writing stories about, but this gives our sources a chance to talk in more depth and have a more open-ended conversation.
Thanks for joining us. I have with me Mark Wilson, education reporter for the Evansville Courier and Press. I've collaborated with Mark a few times over the years on stories, and I've always thought, this guy ought to be on TV. And here he is. So, Mark, it's good to know that you can carry the ball for us over the finish line if I happen to wipe out my microphone or fall over or fall out. It's good to have you here.
Hey, Tom.
Tell us about what the policies are in the school districts in this area.
Well, as the EVSC started the year with a mask recommended, but quickly changed to mask being required indoors all the time, including at desk. I think the concern, as Dr. Smith noted in his podcast this week after the board meeting, is that things are just moving much more rapidly with the virus spread in the community this year than they were last year. He noted last year, the week of the first football game, for instance, there were 130 cases. This year, there were over 1,000 that week. So that was for the entire week in Vanderburgh County. So I would not expect that to change anytime soon. And I would actually expect additional measures soon, maybe like attendance measures, restrictions at athletic events. If we go to where we have to send students home for virtual instruction, athletic events, of course, will be canceled as well. So, in Warwick County, they started the year with masks required all the time indoors. And as their superintendent explained in a letter to parents there, it's not only a safety measure, but it's also because anything within 6 feet is considered a close contact. So if one student has to go home, has the virus, then anybody else who has been a close contact also has to, and that can add up pretty fast as far as empty desks in a school. So they are requiring masks through the end of this month. I'd be very surprised if they did not extend that, at least on a month-to-month basis.
Well, tell us what's going on with the Catholic Diocese.
The diocese just this week has updated their policy. It kind of makes it clearer, and it's a color-coded policy that's fairly similar to the way that EVSC is doing their policy, where it's tied to the weekly COVID metrics that the State Department of Health puts out, that shows how bad it really is in counties. So with the diocese, if that metric is in the red or orange, as it is for Vandenberg and our surrounding areas now, all our counties are one or the other of those, then masks are required all the time in buildings. If it starts to go down where it's in the yellow or the blue on that map, which changes every week on Wednesdays, then they will have no restrictions. So I guess at that point it would just be up to individual students as to whether or not they would like to wear a mask. So and so that's what they're doing.
That map can be found at coronavirus.in.gov, right?
Yes, it can. One interesting thing on there as well is that you can also tab over and find a weekly update of new cases in each school that reports it to the state, which I believe is all schools, if not all, certainly most. So you can look and see what is going on, at least get a rough snapshot of what is happening in your child's school.
Okay. Appreciate that update. Thank you, Mark.
Thanks, Tom.
And we're joined now by a couple of parents in local schools. And Lynn Masaragian is a contract nurse who also has one child at North Junior High and one at Signature School. And Eric Barton, here on my left, has one child at North Junior High and a 7th grader and a 5th grader at Daniel Wirtz. So, Lynn, tell us, what is your take on the policies that are going on to mitigate COVID in EVSC and at Signature?
I'm quite pleased that EVSC and Signature have decided to have the mask policy in place. It dramatically decreases on the rate of infections. It doesn't obviously prevent all of them, but it decreases them, including taking those home to their parents, grandparents, etc., and keeping lots of kids out of school from contact.
Is this something that comes up among your friends, among other parents at the schools? You guys talk about this a lot?
Yeah, it comes up, the pros and cons of the mask, the social, how it might affect the kids socially. But, socially they would be even worse off if they had to do virtual the rest of the year, like Brownsburg.
Well, what do you think is the proper distance between students in a classroom?
3 to 6 feet, masked.
Okay. All right. Well, Eric, how do you feel about the COVID mitigation strategies at your kids' schools?
Ian, I get my kids confused, sorry. Ian, in 6th grade last year, and had to wear a mask all year last year. He hated it. It was something he dealt with all year. They had to be masked all year, regardless of social distancing, regardless of the fact that kids do not easily get COVID. They don't easily transmit COVID. And if they do get COVID, it's a very mild cold. I'll just say that all of us have had COVID, and most of our kids didn't show any symptoms. Ian had just like a day cold type symptoms, and he was fine. So to mask them when studies tell us that masking doesn't work. I mean, Fauci and the CDC can't even correctly say, well, you need a mask. No, you don't need a mask. No, you need 2 masks, you know. Studies have shown that aerosols go through, 90% of aerosols go through masks. So masks just don't work. And so if you're social distancing, if you've, if masks just really aren't needed, in my opinion. And what the detriment that you alluded to of the social implications of masking, not being able to see that, read the teacher's lips, communication, those social cues, smiling, all those things, not being able to breathe well. I mean, those are all way far worse than mandating masks that don't do anything to stop the spread of COVID to begin with.
Eric, I think earlier this month, Tom had a story in which he reported the CDC was saying that at that time, which was July 31st to early August, they were seeing kids up to age 17 being hospitalized with COVID at a rate of about 217 a day. This is nationwide. And, we have been seeing reports of more pediatric wards and children's hospitals saying that they are starting to fill up.
Sure.
I think in early August it was also reported that children's hospitals in Tennessee were near capacity, and were worried that they were going to have to find alternative solutions because they were about to be full. So I think there is some evidence that it's affecting children at a younger age. Just this week, we also had a report about Vandenberg's numbers that are starting to skew younger, where they're starting to see more cases of people in their 30s and now their 20s, and even a few kids is how they put it.
Yeah.
But I think there is some concern this year that children may be affected.
There's always concern, obviously. Nobody wants their kid to get COVID. Nobody wants their kid to be sick. I just don't feel that masks are doing anything to prevent that.
Sure.
I don't want any kid to get sick. And I put my kids in EVSC because we like EVSC. We think Dr. Smith and the school, EVSC teachers are awesome. We just don't agree with the masking policy. And it depends on who you believe. Dr. Smith himself said last year, or the 2019 year before, they had thousands of flu cases. So he was making a point that, I don't know that he intentionally made this point, but he was saying, well, the good news is flu cases are really down. Well, the reason being is because there's no flu, everything's COVID. So, and there's no test to test the COVID variant that they have right now.
That's not true.
There's just no proof that masks work. In fact, there's proof that masks don't work, and the detriment that happens to kids. And as a parent, I'm talking as a parent, not a medical expert, and just what I see and what I observe and what I'm listening to, that and they're having mask breaks. I mean, masks either work or they don't work.
Well,
so let's make it mandatory at all times or not at all.
Lynn, you're a medical professional. What do you think about what you've heard?
Well, so the CDC has come out with a couple recommendations over the past year. They're clinical evidence based. Sometimes takes years to get, so some of it we are basing on common sense. We're seeing families, the whole family's sick. They're not masking at home, but we're masking at school. We don't have whole schools going out, except in the case of Brownsburg, where they did go out and close the school down a few weeks ago. But we have we do know that the masks prevent. We do know that there was no flu last year because people masked. We know that it doesn't prevent every case, but we do know that we're masked, and we've been masked in the hospital since day one. The Delta variant is 40% more transmissible than the Alpha variant, which is what we saw last year. Young people are being affected, the under 50 group's being affected, the kids are being affected, people are getting sick, our beds are filling up. It's very concerning.
Okay.
I think just this week, Dr. Smith of the EVSC noted that cases have been ramping up this school year much faster than they did last year at the beginning of the year in the same time period. And so he has the school officials are a little more concerned this year.
I have to cut you off. We're out of time right now. Sorry. We have with us Dr. Matt Thompson, Superintendent of MSD Mount Vernon in Posey County, a district of a little over 2,000 students. And we have Jean Hitchcock, Executive Director of the Signature School, a public charter school here in downtown Evansville with about 390 students. Dr. Hitchcock, explain please the policy that you have had in effect in Signature since the beginning of the school year, and how is it going?
We have the policy of masks on. We try and have the students 3 feet apart at a minimum, masks on when they're indoors, and masks off when they're outdoors. So as per the CDC recommendations, of course, if they're indoors and they're eating, they can take their mask off then. It's going very well. We haven't had any issues. I don't think anybody likes wearing masks. I think it's not the way we wanted to start this year, but in terms of COVID outbreaks, it's been very smooth.
Now, you don't have a big sports program there. It's cross country and golf. Is that correct?
Right. So unlike other schools with lots of that to consider, we don't have that. We're 9 through 12, so we don't have to worry about little ones either. But in terms of sports, we have golf and we have cross country. And so those are sports, of course, that individual sports where they can be they're outdoors and they're easily separated. So that those programs have gone on and we haven't had any problems.
How did you arrive at your policy? I mean, did you do that in consultation with the health department, the hospitals?
Right. We always, of course, we follow the CDC and the Indiana Health Department guidelines and recommendations. We always are aware of what those are, but we do consult with epidemiologists and health specialists in terms of what they recommend. So, and then I bring it to the board, we discuss, and then we arrive at a policy.
This year, have you had any well, this year, can you explain how your online learning is different? I understand there have been some changes from what you offered last year.
Last year, we offered, the summer before last year, so everybody had gone through the spring of the March through May of just total upheaval. That summer, we put a lot of money into, close to $200,000 into technology. So that allowed us last year to offer to our students an synchronous online learning option. And we had about 10% of our students who took that. It sort of lessened as the year went on. This year, we're not offering that. We want in-person instruction as best we can have it, and so we're not offering that to our students. We still use the synchronous learning for COVID-related absences. So, for example, if we have a child who calls in and says, my mother tested positive and I need to be tested, and we want them to stay home for that, as long as they are up to it, they're asymptomatic, then we allow them to do the synchronous learning.
Okay. Now, I know some public school systems and schools have had, they've been hit pretty hard already by quarantines just because of the close contact issue. Have you experienced anything like that yet at Signature School?
So far, so good. No, we have not had any close contact tracing at all yet. So we've been in good shape with that.
Great.
Mm-hmm.
Dr. Thompson, tell us about the policy at MSD Mount Vernon and how you arrived at it, please.
Our policy is very similar. We are requiring masks at this time. Our county health department's worked with us very closely for the last 2 years. And basically, the state metrics from the dual indicator score will determine if our students will be in masks or not. Anything above a 1.5 or above, 1.5 or above, will require our students to be in masks. Anything below that 1.5 threshold, it'll actually be mask optional. Athletic events so far, we have made those mask optional for the patrons. And up to this point, we've not really had a problem with that.
Dr. Thompson, what kind of virtual options do you have in place at Mount Vernon?
So last year, we did the same thing. We had a virtual option for students, and I'd say about 15% of our students took that option. But as the school year went on, parents quickly found out that that's a tougher road to go. And so those students came back to us one by one, and it got down to a very low percentage actually utilizing the online option. This year, the only thing we're really doing online is allowing the synchronous learning if you're out due to COVID. So if you're quarantined, at that point you would sync into your class and be able to watch live instruction.
Okay, thank you.
Have you gotten much pushback from parents over the policy, Dr. Thompson?
No, we really haven't had a lot of pushback. You know, there's obviously a lot of opinions for or against masks. So I've had some of those expressed to me on both sides. But I think our community understands that we want our children to be safe, and we're going to take the necessary measures to make sure that they're safe.
We heard EVSC Superintendent Dr. David Smith mention on Facebook this week that there was a possibility if things were to get much worse there that they may need to go to all virtual. I don't know, what kinds of metrics are you looking at? How much is that on your radar screen, that possibility?
If we have 10 to 15% of our students in a given building with COVID positive results, at that point we would look to go virtual. We are nowhere near looking at the virtual option for any of our schools right now. Last year we did have to go virtual for about a week and a half, and that was actually due to staff quarantine. Really didn't have much to do with the students at all.
Have you had very many staff affected so far this year?
Coming into the school year, we had, I believe, a few teachers, less than 5, and then a handful of support staff. I'd say it's close to like 8 or 9, somewhere in that range. But you know, luckily, I think only one of them actually was in the building before they realized that there was a problem. You know, everybody else had been sick like coming into the school year, so that was very helpful.
Okay.
What about broadband for students?
We offer hotspots to our students. We also have some hotspot locations in our district that have been provided by SABIC, which has been a tremendous partner for us throughout the pandemic, offering plexiglass and things of that nature. But they offered us $10,000 to make sure that we had capabilities for our students to be able to access all the things that they need to online.
Thank you for being with us here tonight, Dr. Hitchcock and Dr. Thompson.
Thank you.
Thank you.
Thank you.
Thanks to our guests for joining us for this premiere episode of NewsMakers, and also Mark Wilson, our guest journalist. A couple of print reporters trying to do TV. How do you think we did, Mark?
Well, I think we did pretty well.
I agree. Next week, we will be discussing the recently released census results and how they affect our area. And thank you for joining us for NewsMakers, presented by WNIN and the Evansville Courier and Press.